So I'll call the meeting to order. The next thing on the agenda is public comment. We're going to put that down when we talk about the regulation, unless somebody has a comment that is not related to the mask regulation. Are there anybody showing their hand that you know of? Jonathan? Hearing none. Okay. The next order of business is approval of the January 13 meeting minutes. Does anybody have any corrections or changes?
I make a motion that we adopt the minutes as written.
I'll second that.
Okay, so Kay has motion and Bob seconded. And so all in favor? Oh, we have to do a roll call, don't we?
No.
Ashley?
Yes.
George?
Yes.
Kay?
Yes.
Mark?
Yes.
Steve's not here. Bob?
Yes.
I also say yes. We're going to skip all the I forgot to do roll call, didn't I?
Yeah, I would just note that all the board members are here except for Dr. Pritchard, and I think you should be good.
Yeah, I think let's go ahead and do that, since I think our meeting is going slightly long tonight. Next thing, unless anybody has any objections, is there any objections to changing things around like I suggested?
No.
Good, seeing none, okay. The next thing on our agenda will be Shelley Sully. Hello.
Hi, thank you for having me. I guess I'm filling in for Misty Lewis with the HealthNet Foundation. So I'm doing the report. So please ask questions if I'm not giving you the information we need. So I'm doing a report for the 2021 end of year report. We used all 100% of the grant money funded, and we served 12 patients during that time. So I think, as most of you know, most everybody looks familiar, but the prenatal grant is for patients who do not have insurance and are not eligible for prenatal care through an insurance program. We make sure that they get on the Medicaid program for emergency Medicaid, which will then cover the deliveries. So the deliveries are covered, but the prenatal care is not. So it's been a really successful program that we've done for years. We did it with the Volunteers in Medicine Clinic, and we're just very, very grateful that we're able to do this and continue on now that we've joined HealthNet. It's been very successful. I can tell you that, and this is where I got confused, that this grant ended in June of 2021, and then we received money starting in January of 2022. So from January till now, we have 3 new patients for that. But between June and January of this year, there are 12 additional patients that have been seen, and I don't think many of them have not delivered, so they will probably be a part of the 2022 grant as well. So we're very grateful. You're helping a lot of women as well as children. So do you have any questions for me? Oh, that was easy.
I'm raising my hand. I was looking for my raise hand. Well, hi, thanks for joining us.
Okay.
I wanted to ask you, what was the grant amount that we awarded you for 2021?
15,000.
It was 15,
Mm-hmm.
and it was the same for this year?
Yes.
Okay. You think you're going to use every single bit of that and maybe more?
Yes, I do. I do.
All right.
Yeah. Well, I think it's a really worthwhile program. I'm really glad we can support it.
Thank you. Thank you. It definitely is. It changes lives.
Yes. Yeah. And as we know, any money that goes into prenatal care, you get back, I think it's 13 times, I believe, at this point. That's what the data shows, which is that's a pretty good investment for me. So
it is. It is. Well, we can't thank you enough. It's very meaningful.
Okay, thank you. Anybody else have any questions for Shelley? Great.
Well, thank you. Thank you very much. And I'm going to go back to work.
Good. Thanks. Thanks for being here.
Thank you.
Thanks, Shelley.
Okay, so COVID-19 response is the next thing. We're going to switch these around a little bit because Vic has to leave a little early. So Vic, if you want to go ahead with the water report, that'd be fun. I'm looking forward to it.
Good evening, everyone. I'm Vic Kelson. I'm the Director of Utilities for the city. I just want to, I was invited to talk about the sampling program that we've had in our wastewater system. We began sampling at both of our wastewater plants in July of 2020, which is about a month after people really started doing that. I think we were one of the earlier utilities in the state to do that. About 2 months after we started, the state funded a program that allowed us to do 8 or 9 different locations in our distribution, in our sewer collection system. And we did that until the end of last December. And then the city administration and our utility service board, Kirk White sits on our utility service board, so hi Kirk, determined that it was worth continuing the sampling program for our 2 wastewater plants. At the Blue Pool plant, for people who don't know this, we have 2 wastewater plants. One is on the north side of town. That's the Blue Pool plant. The Dillman Road plant is on the south side of town. Dillman's the bigger plant, but Blucher is the plant that is predominantly serving Indiana University, and the new IU Health Hospital also is going up there. So we began sampling at Blue Pool. We sample right at the plant. At Dillman Road, we didn't have the ability to install an auto sampler at the time. So we actually have a manhole near Mays Greenhouse, which is on the main trunk line heading to the plant after, that's the last pipe going to the plant. So we've been sampling there. We're going to be able to move that sampling point to the plant here shortly, but I'll tell you more about that in a minute. So overall, the program has been costing us for the 2 locations. We pay around $3,100 a month. And so we've spent somewhere in the mid-20s or low 30s so far. And the state funded program was much more ambitious, and we collected a lot of data. There's a nice report that was produced by 120water.com from that. You're going to see in a moment. Excuse me. In a moment, I'll show you our data portal. There's a place where anyone in the public is free to download the data or make graphs right on the screen. So we'll do that in a moment. But I want to share with you that the program we've been doing, I think, is going to be spinning down soon, not because we don't want to do it, but because we were invited to join a CDC-sponsored program where the federal government will be funding us sampling our 2 plants twice a week. Right now, we've been doing it once a week. So that's going to be a much different program. They'll go through a different laboratory, and I'll explain more about that in a minute. I put some links in the chat, but I'll go ahead and share my screen. And if you've never been to the City of Bloomington's new open data portal, this is on Socrata. This replaces our old Be Clear site. And the way I get to it, because I can never remember anything and I never make bookmarks, is I just search for utilities. And one of the links inside of there is City of Bloomington SARS-CoV-2 wastewater monitoring. So I can click on this, and it brings up information about all the sites we have. But I'm just going to go to the visualization and create a visualization for it. I'm not going to save it. I'm going to make the date be on the x-axis. The measurement on the y-axis is gene copies per 100 milliliters, which is, these are not actually viruses. These are indicator genetic material that shows that there has been viral, these are shed in fecal material, and it's the leftover, I guess, the leftover bits from the virus. I'm not a biochemist, so I don't know all the details of that, but it's not really the virus. We're not risking anybody's health by having them collect these samples or anything like that. I'm going to group them because we have multiple sample sites, And then I'm going to tell it that I want to see the moving average of the data. So you'll see here, this is a graph of all the data that we're collecting. And these colorful lines here, the blue ones are the ones that we're doing all the time. These colorful lines are various locations in our collection system. And the green ones, especially the bright green, is Northwest Campus. That's up near the fraternities. And the dark green one is Steeplechase. And then the Smith Avenue lift station is right there near 3rd Street Park. But if you look here, I wish it wasn't putting the little blob up there. You can see right here, this is August and September in the September range of 2020. That's when the students first came back to IU. That was our big spike at that point. But only on the green line, that's the one up by the frats. And there was a large outbreak up there right at the beginning of the 2020 school year. But it quickly, those data quickly passed through the system as IU's testing program really spun up. And then you'll see here, if you look at these two mountains in the winter and spring of 2021, those are both at the wastewater plants. The dark line, the top line, the one that makes a big letter M, that's from the Dillman Road plant on the south side. The light blue line at the bottom is from the Blue Tripul sampling point. Again, that's representative of IU more than the Dillman Road data are. So this is IU had their very aggressive testing program at that time, and that may be the reason. I'm not an epidemiologist, but that may be part of the reason why we're seeing that the Dillman and Blue Tripul sites were getting much different numbers at that time. And then it continues forward up until the present time. And you'll see here's the Omicron spike coming in here at the end of the data set. So all of this is pretty consistent with what we've been expecting to see in the data sets up to now. So what's going to happen now is these data are in gene copies per 100 milliliters. The new sampling through CDC will be written in terms of concentration per liters. What we're going to do is we've already contracted to continue the current sampling program until the end of February, which is 2 more samples. And then the CDC sampling, I think we're expecting to get sample bottles next week, and it'll be twice a week. So the numbers from the new sampling, it's a different testing methodology, and the samples are going to be about 10 times, the numbers are going to be about 10 times as high. So we're going to create a separate data site for the second program, just so that people won't get confused and think that all of a sudden everything spiked up by a factor of 10 in February of 2022. So we're excited to have been participating in this all this time, and we're really excited to be part of the federal sampling program. So if you have any questions about it, feel free to reach out to me or our Assistant Director for Environmental Programs, James Hall. He's hallj@bloomington.in.gov. So I'm happy to answer any questions.
I have a question. So is there any feeling for how long that lags after actual infections, or what the timeline is in there?
So what I've read in the various industry journals is that the fecal shedding actually shows up a little before the testing. So in theory, if you do a good aggressive job of sampling, you'll see it in the wastewater before you'll see it in the testing results. So that's why I think the feds are doing the twice a week thing. If this becomes something we want to sample for lots of different viruses, they may want to go to every other day or something like that. I don't know what their plans are with that sort of technology as we go forward, but the evidence that I've read in the utilities industry journal suggests that that it actually shows up in fecal material first. So we may be able, if we have a good aggressive testing program, we may be able to see increases before we start to see them in the tests.
So would the drop off also follow that? You would see a drop off there before you saw the test? Well, what was your last data point on that chart?
Well, a week and a half ago. The new
ago, okay.
The new data comes in tomorrow.
Okay,
So
that'd be
right
interesting to see if it goes down.
Yeah, right now our tests are being done. We're sampling on Monday, but we don't get results till Friday. We're
And that line is a
CDC
7-day
program.
moving average.
What's that?
That line is a 7-day moving average.
I think it may be a 7-day moving. No, I think it's one sample per week. So I think it's averaging. I have to look at how it's set up, but yeah, these are weekly data. So we've been sampling on Mondays and getting results on Fridays.
There's a 5-day lead for the peaks in the sewage samples and the actual case counts. It
So
was found in New England.
So if we're sampling twice a week, we should be able to see things a little earlier. And the technology is improving. One of the challenges is that the amount of flow when we have large rain events, we have infiltration of rainwater into the sewer, which can dilute things. The new testing methodologies have a means for compensating for that. So I'm excited to see how that all works out.
Okay, anybody else have any questions? That's really interesting. Thank you for joining us. That was great.
We will continue to publish the data whenever we get it, and the public's welcome to download it or look it over. And if anyone has any questions, please reach out to the Utilities Department. We'll be here.
Great, thank you.
I have a quick question.
You have a question, Ashley?
Yeah, I do. Hey, Penny, is this something that our environmental quality person can kind of stay on top with and share with you?
Sure, we could have Ashley do that.
Yeah, their data, just kind of, that would be good to have somebody inside the health department kind of keeping an eye on that also. And if Vic, is there somebody that our person, what was her name again? I'm sorry.
Ashley.
Oh, Ashley. Okay. So Vic, is there somebody that Ashley, if she has any questions concerning the collections and all that, would talk to?
That would be James Hall.
James Hall. Okay. All right.
So this is it's one more data point, but the numbers that we see in that wastewater testing really jump around a lot, and they just they seem to have a lot of noise in the data. But nevertheless, it's just one more data point that we can use in our analysis. We don't want to kind of put overemphasis on any one particular data point, and particularly not wastewater, because when I look at the data, it just seems very jumpy.
It does get to be jumpy, and that's a lot of that's because of dilution from rainwater, which I understand they're working on technologies to improve that. But we see the same thing. I wouldn't put a lot of weight on any given sample, but I would certainly think that the trends are real. So I think the trends are probably the best indicator. And if you do see it start to suddenly spike up, that probably means something. Spiking down is maybe the non-detects can happen for lots of reasons, but there's only one reason it can go up.
The mayor does share that during our press conferences. He usually, if the data's come in, that's something that he tends to share during the Friday press conference.
All right. Anything else? Anybody? Thank you for coming. Really
Thank you
appreciate
for
it.
having me.
Thank you.
Thanks for the
Have a
information.
good night.
Thanks, Vic.
Okay.
Bye.
The next person is Kirk White from IU on our agenda.
Thank you, Dr. Tolukian, and good afternoon, everyone. Just wanted to come back again this month and provide some more updates and answer any questions. Vic's presentation was timely for me because I can see the trend lines in our numbers, certainly with what he's collecting. No question about it. You're seeing the spikes as the semester begins, And then when we have a break, they go down significantly, or I saw a spike there, right? I expected it probably to be right after spring break last year, which, there's a lot of travel that goes on and people bring it back and that sort of thing, lots of socializing. So yeah, that is very helpful. I wanted to update you on where our numbers are. And I think if Vic came back in a week or two, we'd see his trend line dropping through the floor, because that's what's happened to our numbers. Just to give you an idea, when we started the semester on the week ending the 5th of January, we had a total of 260 cases for that week that ended the 5th of January. The 12th of January, that had bumped up to 544. By the 19th, it had bumped up to 614. And then by the 26th of January, we were up to our all-time high for this academic year of 806 cases. That was our peak. But we expect that is all Omicron. 710 of that was students and 96 were faculty and staff. And then this past week, it dropped down to 385, a huge drop, and probably a 60% drop there. 337 of that students and 48 staff. And then just this week, Sunday through Tuesday night, we've only recorded 41 cases. So we've had a huge drop, and that's really been helpful for us because we're also seeing the same trend lines along faculty and staff absences, which was really causing us some issues a few weeks ago when we had the spike. A couple of weeks ago, we had so many absences, we were having to close childcare centers, curtail different kinds of services and things like that. So now most of our auxiliaries have recovered and we're back up to pretty much full speed. I'm not sure all the dining facilities are back open again, but we had some significant retrenchment we had to do there while all that was going on. And then just yesterday, I think we're down to less than 10 people in our isolation facility, but we did have a peak of up to 90 a few weeks ago. So things are going along much better for the campus. I imagine we'll see that reflected in the numbers. One thing to pay attention to, though, for everyone is that all the testing sites were down from last Wednesday afternoon really through Saturday morning. We fired the labs back up on Saturday morning due to the weather. So there will be some skewing of the numbers just because of that. But we're back up to full speed as of Saturday morning. So I have a better idea on this week's numbers tomorrow morning. A few other things. We've noticed that the demand for vaccines and boosters has really dropped off. We did a big clinic at Assembly Hall a few weeks ago and only had about 300 people take advantage of that. And that was open to the public for a couple of days. Last week, as Penny's probably reported, the site that we helped sponsor with the county and the state at 800 North Indiana, we got it open on Wednesday, but it had to close early. It was due to run also Thursday and Friday, so we missed some opportunity there. The state decided to close it due to the weather. What we've decided to do is go ahead and make vaccines and boosters available at the Student Health Center on demand. So just like they're available at pharmacies and other places, students, faculty, and staff can get their boosters or vaccines at the health center just by making an appointment and dropping in. And we'll keep that alive as long as it needs to be. And I'll tell you that we also have capacity at our building at the former church site at 800 North Indiana, where we did the earlier clinic in cooperation with the state and county. We're leaving that building in reserve right now in case it is needed in an event of another clinic that's needed. And that's partially because we are about to finally get our incentive program for boosters live. It took us a lot more on the IT side than we expected. but students will get a $20 incentive on their iBucks card if they get their booster shot. So we may see an uptick in that once that goes live here within the next week, we hope. So we'll be ready if we see some additional demand. So that's my update. Things look much better on the campus this week than they did a couple of weeks ago. And I'm pleased to answer any questions you might have.
Anybody? I've not seen a whole lot of,
There was a question in the chat.
is there?
Yeah. From an Angela Northcutt.
Oh, it says, if you see a wastewater spike, what will you do with the data? Are you advising the university on protocols, or how do you see this change in any actions or recommendations of the committee, other than warning that a spike is coming? Any comments about how you would use that data, Kirk, or Penny, even for that matter?
Well, I think at the university, anytime we can get a little advance notice on when things are coming down the pike for us, it's great. We did a lot to get ready for what we expected to be the Omicron surge. We saw that coming by the second week of December, and we staffed up as much as we could at our testing sites, quarantine and isolation facility, try to really get prepped. So yeah, if we, as much of advance notice as we can, it allows us to move resources around, or perhaps, have additional personnel ready for testing or another vaccine clinic if need be.
Yeah, that
The
would be
information
on.
itself, sorry, Penny, the information itself, if it's significant, that's coming from that wastewater testing, if we really see a spike, I think maybe the best use of that information is to let people in the county know that there may be a surge coming. It's more like information sharing, and kind of decide for yourself how to up your game a little bit. If there may be signs that might be coming back or something.
How are the masking at the ball games affecting the future? Are there more people cooperating now?
I think our trend is still pretty good there. However, what we've seen all along is when people see that things are getting better, then they let their guard down. And I guess that's human nature. To Mark's point, though, I think when people see that things are more threatening, then they start to mask better. I think we see that in the community. Penny, I don't know if you're seeing the same kind of trends.
Yeah, and that's, one of the things that businesses, people out have said the same thing, that during the spikes in cases, certainly compliance with regulation increased, even where people didn't necessarily have to wear a mask, that they were more likely to. And I would agree. I think that having some indicators could help us decide if we need to request additional testing to be ready for that, as well as communication and how we get that information out.
I really like Mark's point about behavior, because I think, I'm down in South Carolina where they're, it's a little different down here. And people weren't wearing masks at all. But now, when I came back, in the winter, people are wearing masks down here. There's no mandate, but people are changing their behavior in response to the information about Omicron. So I think that if we can get that information to people so they can decide how they want to handle it. But I'm impressed at how many more people are wearing masks down here now. Mostly people like older people who are more vulnerable. But I think that getting that information out to the public can be very useful for helping people change their behavior appropriately.
Well, Carol, one other point. Starting 2 weeks ago, when we saw the spike happening, we really hustled around and started distributing KN95 masks to anybody who asked for one. So those are still being distributed at our testing site at Gym 171 at Garrett Fieldhouse at the Public Health Building.
That's good. Do we know if masks have gotten into the pharmacies yet, the ones that the government's providing up there? They
Yes.
have? That's good. They're not here in South Carolina yet, but okay.
So the
Anything
students are really taking advantage of the N95s, the free N95s, and maybe sometimes nudged by the faculty, like me giving extra credit, just a little bit of nudge there. So, and
Good for you.
even in my classes where I don't give extra credit, they're pretty good. They've been picking those masks up, and I really notice.
Well, I'm glad to hear that. And we thought a lot about how to distribute them. And then we decided, the best place is the same place that they're getting tested, because those are the folks that are unvaccinated. So let's make it easy for them to have a KN95.
That's great. That's good.
And, sorry, one last thing is the campus, IUB campus, has a 95% complete vaccination rate, 95%.
That's without boosters, though. That's just the first 2 shots, right?
That's correct. First
Cool.
2 shots. Yeah.
It's good. I'd really like to see a lot of our younger people get shots. That'd be great.
That it would.
Yeah. Anything else for Kirk? I really
Well,
appreciate your being here. I really appreciate
Thank
it.
you very much. I'll come back and join you again next month.
Great, thanks. We love seeing you. Okay, so next is the Public Health Clinic. Is that going to be Jama today?
Yep.
Okay, hi Jama.
Hi. So the biggest news, I guess, right now is we have the vaccine for children ages 6 months to 4 years old, potentially getting approved as early as the last week of February. So we actually have vaccine on order to be delivered on the 21st, so Monday after next, so that we will actually have that in hand, ready to go as soon as it gets approved, if that happens. So right now in our COVID vaccination clinic, we are seeing kind of a sharp decrease in the uptake. We were averaging about 80 some doses a day administered, and we're seeing that drop down to like 40-ish, maybe even less on a couple of days here and there. So that may increase again a little bit with the opening up for the kids, if that gets approved for the younger kids. But it seems like the demand overall is going down for those booster doses, just like IU is seeing. We're also still, supporting the schools. We have a new school nurse liaison, or not nurse liaison, but a school liaison who's going to be helping support the schools with their COVID efforts and ensuring that they're reporting and they're in compliance with all the health regulations. Seeing if they, what trends are going on and offering guidance, making sure that they're up to date on all the current CDC and state guidelines, and just making sure that they have all the most recent information available as far as, testing and immunization options. That position will have the opportunity to be renewed for another year at some point. So if we need that, that's an option for us. And the other thing I wanted to mention is just a follow-up from last month's meeting. I was asked to follow up on some immunization rate questions. So I think you all had some reports that we sent in attachments about our county rates versus state rates, and then the public health clinic individually. So there's kind of a lot of information there. Is there any questions that I can answer?
Yeah, I have a question. So the rates look really pretty good. I mean, obviously compared to the state, we always do better than the state though.
Mm-hmm.
But do you know how that compares to like 2019 before all this? I know 2020 rates are terrible, but before COVID hit?
No, and that's kind of hard to determine too, because they've also switched the software that they use to analyze that data and compile that data. So they used to use a system called COCASA, which would give like an overall rate for the children who, in a certain age category that were up to date on all routine immunizations. Now they're pulling data just from CHIRP. So it's kind of a different looking picture. And so I don't have the, side-by-side comparisons for you, but I can tell just by what we're seeing at the clinic that we're not seeing as many kids come in for the routine immunizations as we had, prior to a couple of years ago. So I wouldn't be surprised if that was lower, but they just report it differently now. Like I said, before they reported it as an overall rate for all immunizations. Now they're breaking it down for each individual immunization.
Yeah.
So it's not really.
Remember, it seems to me we were more like, kind of at 85-ish a couple of years ago. And these seem a little bit lower than that. It just.
Yeah. Which is not surprising.
Yeah. I just wanted to see these kids get caught back up. And do we know what the COVID immunization rates for the 5 to 11 what percent of our kids have gotten vaccinated?
That I'm not sure about. Penny, do you recall if we had an estimate with the numbers? Because I know we were looking at that not too long ago.
Yeah, we were. The dilemma, so we have just under 9,000 is the estimated population. The challenge that we ran into is how many have their first dose or is it their second? And so we ran into a little bit, but it is, at one point we looked at it and thought it was as high as 20%. It may be more like 10%, but that's a challenge that we've run into when we dig deeper into that, trying to sort it out. So part of the problem too is with census data, it doesn't break it down by 5 to 11-year-olds. So when we look at some of the other data, it looks like it's probably for 5 to 9-year-olds, it may be 5 to 10%. So, but it's hard to know how many have only their first dose or how many have their second.
Right.
Yeah, it's just a little disappointing. It seemed to me like right at first, people were saying they couldn't find the vaccine. They were going to other counties to get the vaccine. So people seemed like they were pretty excited about it. So I'm not surprised the rates are that low.
Yeah, we did a lot of vaccines. And so we'll continue to dig around in that and see what we can find.
Hard to find the data. So the schools don't collect data on the vaccine though, right? Right. Can they?
Well, I would say the dilemma is, how they get it. They're able to check, for instance, when they're doing contact tracing, if somebody's been vaccinated. But I don't know that they can go in and just run a report on who's been vaccinated. That makes sense, but.
They collect data on other vaccines. I just was wondering if that would be something the schools could do too. Okay. Anything else, Jema?
That's all I have. Any other questions?
I don't see any other questions for Jema. Oh, great. Thank you.
Thanks,
Thank you.
Jana.
And next we have Aaron.
Hey, everybody. Sorry if it's a little loud. I'm in between airports. I'm traveling today, but wanted to talk to you guys a little bit about the compliance checks. Again, I'll start off with hitting on what Mr. White and everybody had said, that, we do see an increase of mask usage when it gets worse, and it gets a little tougher as the numbers go down because people want to get laxed. So it makes it a little tougher for us. So we see that fluctuation. And Penny, I'm sure Penny can attest to that. We see it with the complaints that come into the health department that we follow up on. As a whole, though, it's been really good as far as mask compliance. Again, the numbers have been high, so I think people have had more awareness and have taken more care and worked harder to wear their mask. and we'll see what happens as it goes on. We've also stepped up our compliance efforts with the late night crowds, trying to be seen in those establishments more. So we have a little more visibility out there to try to help the bars and the late night restaurants meet the compliance that we're asking for. But other than that, as a whole, compliance has been really good here the last couple of weeks. Last month, I would say, with just the high numbers and people being more aware.
Great. That's good. Anybody have any questions for Aaron? Seeing none. Okay, thanks, Aaron. Thanks for coming.
All right, thank you guys.
Safe travels. Okay, and now we have Penny.
Yeah, I'll give you just a quick general update, and then I have a little bit of just COVID update to give you before you have your further discussion. So staffing wise, we've been talking to you a lot about different positions we have open, and we're busy doing interviews. We have a new person starting next week, so we're happy about that. We have some new positions that are open, so if we have an LPN that's watching, or we have somebody that is interested in public health, we do have some positions, and we're in the process of filling those now. And as Jana talked about, Emily moved into the full-time school liaison position, and so she's really getting settled into that and has been working with our nurses, connecting with the schools. And so there are some changes to that grant that the state is making, in part because changes to schools and how they report and whether or not they have a mask requirement dictates how much reporting they may have to do and so on. So there's a few tweaks being made to that funding, but we are looking for that to not only be focused on COVID vaccination and recovery, but also on other immunizations. So that position will also be able to help get those vaccination rates up if we need to do clinics. We already go into the school and do catch-up clinics and things like that, where some other counties don't do that. But we'll be able to really do some targeted things with the immunization money, and that position will be able to help with that as COVID winds down to be more manageable, and we start looking at other things. But even just doing vaccine clinics where multiple things are available, and they're MedWise, I think that that's the right group, but that there is another group who's doing some vaccination clinics at Ivy Tech locations to help catch children up too. So I think that's through the Immunization Coalition and a connection there. So our nurses have been in contact with them about that. So we're happy for that. Lots of legislation, and lots of it are just in various stages of the House and the Senate. Lots of health related bills out there, from real estate inspections to COVID to mental health, all kinds of things out there. So do encourage you to pay attention to those bills. And I think I've sent you that link, so you can watch for those. Our strategic plan is in place. Our community health assessment, the data is in, and that's being pulled together. That final report should be available by the end of March. And we are joining forces with Community Voices for Change. There's a lot of activity going on with them and the same people that we deal with, right, in the think tank in our community health improvement plan. So we're really thrilled to kind of join that and expand our group and our reach. And we're looking to have that think tank rescheduled for probably April, maybe into May, and to expand that and really build some great community health improvement plans for the coming years. So we're looking forward to that. And then Kendra, my assistant, has been putting together some short slide videos talking about public health, kind of what is public health and all the pieces to it. And she is doing a fabulous job with those. I'll be sharing those with you, and we're sharing them on social media. But so talking about what does environmental health do? What does Futures Family Planning Clinic do? What do all these different areas do? So that when we get them all together, it is kind of this full picture of what the local health department here in Monroe County does. So we're excited to have her here and able to provide that for us. So, and Jonathan, if I'm going to share my slides, but I am poor at this. So, let's see. All right. Can you see, can you see that? Because I have a split
Yes.
screen and I can't really tell what you're seeing. So,
Yeah, it looks good.
okay, great. Tell me if something messes up. I'll try to go through this quickly. We've talked about a lot of this before. There are testing options in town. The Gravity site continues to make things a little bit easier for people. Indianapolis Motor Speedway has been extended. Mobile clinics, as Kirk talked about, we had several of those last week that ended up getting canceled. However, we're looking at whether or not we want to have them come back, how frequently, where we want them to go. At the Sherwood Oaks Clinic, got fabulous reports on that. And then vaccine availability, Jana was talking about that a little bit. Most of, and this is true across the state, most of the doses being given are booster doses. There's still some first and second doses going out into arms, but what we see mostly are people picking up their booster doses. Right now, we are looking about a 60% vaccination rate on first and second doses in our county, which is where we were this fall before they started adding new people who were eligible. So in some respects, that's good. We've kind of caught up to that a little bit. We still have some expanded hours at the public health clinic. There's providers' offices, pharmacies. So we encourage people to get that vaccination. And the other thing that Jana touched on was the possibility that vaccine will be available soon for those who are 6 months to 4 years old. So the FDA is reviewing that data next week. And then if they approve it, then it will go to the CDC. And so there's still several stages of approvals and directions that have to occur before we would be able to have vaccine and get it in those arms. But we are hopeful, and the signs are good that that will come in the near future by the end of the month. Something that has also changed more since the fall when we were meeting and we thought that we were going to have that low level of transmission before the surge kind of started hitting, but treatments, there continue to be more treatments available. And Eli Lilly has just announced that they have submitted for emergency use authorization for a new treatment as well. I've got the link to that if somebody wants to look it up. The Indiana Department of Health dashboard continues to have a treatment map, so you can find the options that may be near you, or if your doctor has recommended something, that can be used to try to find that treatment. But that is a good thing. That is a change. I have to say that as we look back, every 3 months, every 6 months, things change so much in that 3 to 6 months, not just in one area. We can look at rates and cases going up and down, but the other things around that change in terms of vaccinations, their availability, who's eligible, treatments, all of those things make a difference. And then the effectiveness of masks. We continue to find and see reports of masking and how they are being used. This is information on a recent study that was released talking about people who in California, I believe is where this was done, and it was people who reported always wearing a mask in indoor public settings. And again, that's the recommendation if your levels of transmission are high. And so you can see that masks clearly made a difference. The better your mask, the greater your prevention, your protection, certainly. But I'll also take the moment to remind us all that the best mask is only as good as we wear it. So if we don't take care of it, we don't wear it well, then it's not going to do the job that it should do for us. But this is a new study that was out if you want to take a look at that. And as a talk about masks, and we talk about schools, the CDC has updated guidance for higher institutions of higher learning. That is not part of our regulation or authority. So those guidances have been released, and I know that IU is incorporating all of those new guidance pieces into their policies. The Indiana Department of Health does have requirements for quarantine, contact tracing, reporting that are different for schools. And when I talk about schools, it's K through 12 with a mask requirement and for those without. So if masks are required in a school, then that means that there is less need for people to quarantine and less direct contact tracing that the schools have to do at this time. And we continue to see a lot of changes happening with school requirements. So even if you were to remove the local requirement for masks, schools would still need to follow the requirements of the Department of Health based on their mask policy at this time. And the good news, Indiana is reporting case trends, and as Kirk talked about as well, it's what we're seeing starting across the state. So cases have decreased most significantly in the Northwest and central parts of the state. And this is also where we saw the surge take hold first. So some of the counties have seen a decline by 90% since the peak. Now, if you've paid attention, and I know you all have, to Omicron, it's a surge, it's a spike line straight up, and then it tends to come out of that surge much the same way. So the decline is less significant for southern counties. For instance, we didn't peak nearly as early as some of those northern counties did, but every county seems to have already peaked at this time. And again, I will just say for our numbers, last week's test site closures impacted our numbers a little bit this week, but we're still seeing an overall decrease in our numbers as well. And in terms of positivity trends, that also is showing a decline in the state. So 7 counties, this is from last week's metrics, 7 counties had a positivity rate below 20% last week. I don't think anybody was below 15%, and 15% is still the highest percentage. So our goal, remember in our regulation, is to be low and blue, and that would be 5% or less. But 28 counties have positivity rates that are over 30%. So there's still work to be done. Last week, our positivity rate was 21.6%, and it should be about 20% today. The state dashboard did not get updated, and it had not yet been updated when we came into this meeting. So could be a little bit off, but it should be right there. Then one of the other trends that we look at are hospital trends, what's going on in our hospitals, and they are showing a decline as well. And this map is by districts. We are District 8, so a little bit slower to have a significant decline. If you watch our press releases or press conferences on Fridays, you know that IU Health Region has talked about a plateauing, a slight decrease. We haven't seen a large drop yet. But remember that hospitalizations lag behind cases. So So we expect this trend to continue and anticipate tomorrow during the press conference that the hospital may have some good news for us as well. So just kind of a summary, transmission level is still high, but we are certainly, everything is pointing that we are coming out of this surge. Those who are up to date on vaccinations do have the greatest protection. And when we say up to date, that means if you're eligible for a booster, you've gotten it. It doesn't mean you won't necessarily get infected, but the risk of you being in the hospital or dying from infection is greatly reduced if you are up to date on your vaccine. And even we see lower numbers of infection as well. We did see an increase in breakthrough cases with Omicron. There is more testing available, including home testing. And with that, it is not reportable. We will start to see at some point this move to really thinking in terms of recovery and how we handle cases and reporting in a different way. Now that we have information, we can start to look at that differently because we've learned a lot. And so we should anticipate that reporting requirements may change down the road as well. But our prevention strategies, those haven't changed. That is one thing that has not changed. So vaccinate, mask up, wash your hands, limit possible exposure, quarantine, isolation, testing, all of those things are important. So before you go into your end of business and talk about the regulation, just to kind of hit the high points, that the current Indiana governor's executive order is set to expire March 4th. Now, it could expire, he could let that order just expire, and he might do that because trending cases are coming down and things are improving. He's also indicated that there are certain things he wants legislatively before he would consider letting the order expire. And so we don't know what will happen come March 4th. But regardless, if you want to make changes, don't make changes, you do need to think about that expiring order. So if you don't want to make any changes, then you do have to think about, do you want to let your current order expire whenever the executive order expires? Do you want to request a local declaration from the commissioners and then continue with some sort of local regulation? The other thing that you could do is look at making changes, adjusting measures for lifting it locally, setting a specific expiration date. But again, if you were to go beyond March 4th for that, you would need to have a plan if the governor lets the state order expire. So that's what I have for you. And just wanted to give you that before you go into the rest of your conversations.
Does anybody have any questions for Penny before we go along?
Well, Penny, you sent an email, and the email had a series of masking data, 150 some cases where masking data didn't show any positive effects. Can you tell me a little bit about the source for that data?
That was a forwarded email from someone who sent information and wanted that forwarded to you. And so if you, anytime that you are looking at various pieces of data, it's always important to look at the source, where it came from. Is it peer reviewed? Has it been studied? How big was the sampling, and those kinds of things.
How did you interpret that?
Well, I know some of you had looked at it and had comments about that. I think that some of them are not peer reviewed. They're not scientific sources, but it's hard to clump everything together, certainly. But, you know, there are plenty. And the one that I shared with you from the CDC that just came out last week, that masks clearly do make a difference. You can look even early on. There is the study from an airplane where everybody was on the plane and there were people who were traveling because people were masked, there wasn't transmission. And there's a hair salon study that was done where 2 stylists were infected. Everybody was following a mandate and not wearing masks, or were wearing masks, and nobody was infected. So that's, there's lots of information out there.
Bob, the thing that she handed out on effectiveness of masks, which we got 2 days ago from the Indiana, from the Indiana source, showed for the first time that I've seen was 534 people that, in fact, if you wear a mask in public, just the cloth one, it's 56%. That's quite a bit. 66 for hospital masks and 83% decrease odds of turning positive if you wear an N95. So 56, 66, and 83. So that's the first really good thing I've seen yet about effectiveness of masks. They really do work.
The N95 seems to be the way to go, but if you're using cloth masks with pictures and faces on it that aren't very effective, I'm sure the data gets skewed from that source.
It's 56% for cloth, 66 for hospital, 83 for N95% decrease in positivity rates of people who always were wearing a mask in public, indoor public settings. So 534 people, indoor public settings, all the masks work. Cloth less than, hospital less than N95, but 56, 66, and 83% decreased likelihood of turning positive. So that's, you can use that for pretty good justification about wearing a mask. They do work, turns out.
Yeah, I think that we could pretty confidently say that the science is settled about masking being effective, but at the same time, we gotta recognize that there are negative effects that affect everybody, so just to sort of, for us to say masks are effective, therefore we need to continue wearing masks and do it by mandate. Maybe we want to talk about that, and if I can kind of give you sort of, as Penny was talking about these factors, I'm making sort of mental notes in terms of all these sort of other factors that are going on now, besides just sort of saying masks are effective. Like number one, our vaccination rates, like we just said, that IU Bloomington campus has a 95% vaccination rate. Monroe County, Penny just said 60-ish. It's like right at 57%. That's quite high. We currently have a high transmission rate if you look at the dashboard, as does all the Indiana counties. But it's 100% Omicron. And Omicron, that variant seems to, it's the prevalent strain, but it's less severe in its manifestation. And a lot of people are getting Omicron that don't have symptoms. They have very mild illness. They're good about getting tested, and they find out, oh, I got COVID, right? And they do the right thing, but they get past it. So that's another consideration, is the strain that we've got is maybe a consideration. Daily positive cases are on a dramatic downward trajectory, like we've already said. Okay, but if you kind of look at exactly where it is right now and kind of reverse extrapolate and look back, it's as high as some of those other peaks that we're really concerned about. So that's a factor that says, well, maybe we should be really concerned right now until we get even much better and down to the last summer's lowest levels. Okay, but it's the Omicron. It's the Omicron. It's not the Delta. So many people have had these subclinical infections. They've gone through the holiday season, and I know this from my students. I had so many absences during the first part of the semester. It's like 15% of my students were out from COVID. So that while that was bad then, we can look at that now and we can say, you know what, they have achieved a greater level of immunity. Like there's a lot of people out there that are that were never vaccinated in the first place that naturally got Omicron, and they've achieved a level of immunity. So you've got maybe a higher level of immunity than you might think looking at the 60% Monroe County level. So that might be arguing more for, we're coming out of the woods quicker than we might think. Hospital occupancy is my concern. Hospital occupancy is high. Now, we have available beds. If you look at the dashboard, you can see by district, you can see the bed availability, ICU beds, non-ICU, and there is availability, right? But that doesn't mean that our healthcare workers aren't just totally worn out and they are just done, right? And hospitals are losing workers. And I heard a story on NPR coming in this morning about how many more nurses we're going to need in the workforce. The state of Indiana's got to produce something like 3,000 net new nurses per year over the next 10 years to get to where we need to be. Okay, so we can't chase nurses. We just can't chase these healthcare workers away by just wringing them out anymore. Even if we have a bed there, that doesn't mean that we're providing that top level care. So that the hospital occupancy is a bit of a concern, and it's an intransigent number, right? Because you got these people that have long lengths of stay that are in the hospital, and so it hasn't. If you look at District 8, the hospital occupancy hasn't gone down yet. Okay, so I noticed that. I kind of put all this together, and I think maybe it's time to consider just leaving this up to people, at least on the masking side. And there is like, eventually you got to decide when you can lift a mask mandate. There has to be a time, right? And I see that time right around the corner. It's right around the corner. So I would ask, what if we said, Penny, that upon the expiration of the governor's emergency public health order, that the mask mandate is lifted in Monroe County, what other considerations would we have to think about in the order that we have locally? Is there something more that we would have to decide beyond just the mask issue? Because that seems to be the biggest issue, right? But what else is there that we would need to talk about? Is there anything?
The current regulation is really about masks. Now, you could do recommendations. You could make a statement that these are the things that we want people to do. But currently, the regulation is about masks. So it's wearing masks in indoor public places as long as our transmission is high, and that schools are required to follow the guidance from the Indiana Department of Health, which is currently recommending them. Now, if that expired, then schools technically would have the choice, right, to require masks or not. And then and this is just currently, based on that decision, would determine the extent to which they do contact tracing, quarantine, and those kinds of things.
So basically, a current ordinance basically says they need to follow CDC guidelines. That's basically it. So if our ordinance went away, they still have to follow Indiana State Department of Health guidelines.
Yes, yes, but the State Department of Health right now, they would have the choice as a school corporation, they would have a choice to require masks or not. What they would not have the choice about, there are specific requirements in terms of how they do their quarantine, how they do their reporting, how they do their contact tracing, that is based on whether or not they require masks or not.
Okay.
Yeah.
All right.
And
So-
all of that school guidance changes regularly at the moment, I will just say.
As does everything with COVID.
Yes.
Yeah.
Yeah.
Well, what about the group sizes that the city and we have the,
No, we don't. The only thing the current regulation has is masks. Everything else in there is a recommendation.
okay.
Okay.
Mhm.
Before we listen to the public comment, which I do want to listen to, is anybody, any of the board members have any other comments about the board or about the regulation or where we should be going with it? We'll vote on after the public comment.
I'm a little concerned about the possibility of new variants lurking in the weeds. There's already one that's been reported on the East Coast that's unclear as to how it goes with transmission and virulence. The other issue is if we do give some sort of shutdown to the mask mandate, how about the possibility of the need to raise it up again? Because RNA viruses are very mutable and they're just likely to slap us with a new one very shortly or maybe sometime in the future, and we'll have to tell people to mask up again. Are we going to get some kind of bad reaction to that? Having said that, I would recommend just now linking the masking to the color coding and talk about when we achieve the yellow status, which is what, Penny, 5% or something of activity?
I would have to hang on. No, blue would be,
Blue is
well,
fine.
it's all based on a 2-score metric. So it's your cases per 100,000 as well as your rate. So hold on one second. So yellow would be a 1.1 to 1.5. So you'd have to have cases below 100 per 100,000 and your positivity rate below 10%, or some variation there. Keep in mind that it's a 2-metric score. So you could have a 3 in one and a 0 in the other and make that.
This
if I
would
could-
have the advantage of really tying it to an achievable end rather than merely dropping everything and letting everybody take everything according to some recommendation. That's it.
Yeah, George, that's still using the metrics that we sort of used before that was, for the Delta and when we didn't have high vaccination rates. And so I'm a little leery of tying things to the old metrics given our current situation and our trajectory, because I can envision that under the Omicron that maybe we would never achieve, that never see a blue again. We just end up with this endemic kind of, it crops up here and it crops up there, and then it's like 58, 59. It's always bumping around up there above 50, and the hospitalization rate goes way down, and it's just because it's endemic.
Point taken. We may just have a new form of influenza.
Right. And I mean, if we're lucky. So I don't know. I'm very much inclined to make a motion if I might.
Shouldn't we listen to public comment?
you want public comment first, or do you want a motion that's on the floor?
We'll have public comment either way, so it doesn't matter. If you want to make a motion, I'm fine with that. Again, we won't vote on it until after public comment, so.
Well, yeah, okay, so, we'll have, let me just kind of put that motion out there if I could.
Go ahead.
I move that the Board of Health recommend to the Monroe County Commissioners that the current Monroe County Health Order requiring the use of face masks while indoors in public places in Monroe County be rescinded at such time in the future as the governor's public health disaster emergency health order expires and is not renewed. The current executive order is due to expire, as Penny said, on Friday, March 4th.
Yeah, and Jeff Cockrell Legal is on here. So just to clarify, the motion is very clear. And that would happen. You wouldn't even have to go to the commissioners for that change, because you would just be letting it expire when it automatically expires.
All right, so the commissioners don't have to be involved because it's not enacting or instituting something. It's just letting it. Okay. Then if necessary, I'll just amend that the Board of Health has decided will lift the indoor mask mandate at such time as the governor's executive order expires and is not renewed.
Yeah, and I'm Jeff Cockrell with the county legal. I would just let you know that will happen as a function of the emergency declaration ending. The current health order needs to have an underlying emergency declaration. So if there wasn't one, then it would expire when that does.
Right. Okay, so it's already set to expire unless we request an emergency. What was it, Jeff? A declaration. The commissioners call for an emergency declaration. So ours expires on the 4th unless we intervene and request the emergency order from the commissioners. So we can do that at any time. I mean,
so in theory, this does not require any motion at all. If we just among ourselves said that, we'll let it expire if it expires.
Well, I do want to hear the public comments, but secondly, we still have some time to watch our trends here. I do, Mark, agree with you on the color trends because those are based on ranges too, and we can get really, really low and get close to being blue, and that it's not enough based on the state metrics and then how we've set them. So, I think for the board, some things I would like to have considered are, what measures would we feel would need to get met in order for us to go to the county commissioners to request an emergency order. So, I mean, basically, I think it's up to us to kind of figure out how bad do we let it get, before those kind of measures, because, I mean, as you said, at some point we might want to come back, if after the holidays, we've got Easter coming up and spring breaks coming up, and there's all these other activities out there where people are going to be with their families and with their friends, that we might get more spikes here locally at hospital. I mean, who knows? So I think that that's our end goal, is to kind of figure out what our levels are going to be if we ever do go back to speak to the commissioners and request that.
Yeah, actually, I think, it's this is such a moving thing, we may have another variant that hits the fan here in a while. We don't know. Or maybe that enough people have been vaccinated, enough people have had COVID that we're all relatively immune. And if we get it, it won't be really bad. Like, what's going on, people who are vaccinated and boosted, they get it, but they're not getting very sick. there's certainly an element of our population, the unvaccinated people and people who are at high risk otherwise, who are always going to be vulnerable, but they're going to be vulnerable to other diseases besides COVID, like
Right.
influenza. And so we've learned a lot. We've learned a lot over the last 2 years. And we're in a completely different position than we were when we started making these regulations to begin with. I mean, vaccination rates, like all the stuff Penny pointed out, vaccination rates are high. A lot of people had COVID. We have treatments. Our hospital, I really want to see the hospitalization rates going down because my biggest concern is we get some sort of big surge and we stress our medical system to the point where we can't take care of people. We've seen that with all of our surgeons. We've seen people not being able to get health care because there's people in the hospital with COVID. I mean, we've seen that throughout this entire thing. And that's my biggest concern. It's not people getting a little COVID and, having to miss work. I mean, people get flu and have to miss work. But it is going down. It's 100% Omicron we're seeing now, which is great because Omicron is not as evil as Delta. I wonder where Delta is. Is it still lurking out there somewhere? It seems to be pretty much gone.
It is pretty much all Omicron.
Yeah,
Yeah,
what George said, we don't know what the next one's going to be. So.
And that points to, the vaccines, working and these various behaviors that we've implemented with the masks and social distancing. And, that's kind of the point, is to have it die out and go away.
Yeah. And
and
it seems to me that that's the direction we're going.
Yeah.
I agree with you. I think.
Does Mr. Cockrell
we're just starting to do it. And again, we can always change our minds if it appears that, there's a new variant out there. And I mean, we can always address it again later. We've managed to address it the last 2 years. So,
actually you said, should we have criteria in advance for when they go back? Or, this board is a lean, mean, policy-making, quick moving machine. We are here on Zoom. And you know what? With how many days notice, public notice, we can come back together.
Yeah,
exactly. I mean,
48 hours.
That's what we do is etched in stone, which is really nice.
Yeah. Yeah.
Okay.
Yeah.
So any other board comments before we get our public comments? I think that we see a direction we're going here.
Yeah. The only thing I would just like to state of my personal opinion is that I don't have a desire this evening to end the mask mandate tonight. I'm going to be leaning towards just letting it phase out with the governor's decisions.
Okay. Is it okay if I make a comment that Steve Pritchard sent to me since he's not here? Basically, what he said is that he feels that the mask mandate should just die out with the governor's ordinance as well, but that we should still, as a board, recommend that people, particularly those who are not vaccinated and those who are at high risk, continue to wear masks in indoor spaces. Again, a recommendation, and we can also do things like ask that those lovely things that the health department makes, the signs that we allow business to have. We can require that they have a sign on their door to say that. That's something we still can get our message out there without having to, as a recommendation. We can still do that. That's what that's Steve's comment.
Just to be clear, if the mask mandate is renewed by March the 4th, then our order would continue on if that's the route we took.
If the governor extends his executive order, then our local regulation would continue as well. Yeah.
Has that been signaled or telegraphed at all politically, or has anybody heard anything?
We typically don't hear till the day of. Like we plan, it seems like every day, every time before it's set to expire, we are already in the process of getting our meetings scheduled so that they're in hybrid. So all those things that we're required to do happen once the emergency ends. And then that evening it's announced again. So we have no idea or forewarning of whether it's going to be extended or not.
Right. Okay. Any other comments from the board? So we don't have to have a motion because if we don't do anything, it goes away. Although I do think that we might want to talk about having a regulation. I mean, a recommendation if we get it in place. So that so we can continue to protect those vulnerable people, which is what the goal really is. So we didn't make a motion.
So Carol, you're saying that, with the lack of a specific motion about this that we don't need, we would just kind of continue to recommend that people mask up, and particularly those that are highly vulnerable. And is that kind of what you're?
Yeah, but we'd have to make, Penny and Jeff, we'd have to make that as a motion, and have a recommendation, right? Which should be basically what we have now, but so we'd have to do that as a motion, correct?
I think you can, but I would also still stress again that if there is no underlying emergency declaration, there can't be an order. You can always put out your recommendations. You could always say we recommend whatever is the appropriate thing to recommend. So
right. But we would need to vote on that. So in terms of Mark's motion, which basically said to let it die on when the emergency does, and let people make their own decisions after that, is what you said, basically, Mark, right? Correct?
Yes.
Okay, that's what I thought. Okay, so which would happen anyway if we don't vote on it anyway. So I mean, we can so we don't. The bottom line is that motion isn't even this. It's what Mark suggested would happen anyway if we don't even do anything.
Right.
Yeah.
Okay.
Right. So nobody seconded.
Is there a second for that motion? Apparently not. Okay, so that motion dies. All right, so now I think it's time for public comment. Unless anybody else has anything they want to say. I would really want to hear what the public has to say. And okay. So who's in charge? Who's out there that wants to make a comment? Do we have any hands up? And there's it looks like.
Well, we should probably go over the rules real quick.
We should go over the rules. Thank you for reminding me of that. Basically, it's 3 minutes. There's a warning at some point, right? When is that?
30 seconds.
Is it 30 seconds?
Yes.
And do you want to demonstrate the sound? Is it Andrew is there now?
I don't.
Andrew or Jonathan?
Is it Jonathan still? Okay. Jonathan, you want to point out the sound that they'll hear at 30 seconds? Oh, you don't have a clock program. Okay. Well.
I thought
What happened? Well, how do we deal with that, Penny?
We can the best we can do is just ask people to keep it brief. We can time it to some extent.
I can time it on my phone.
Yeah.
So I can do that. Okay. All right. So looks like there's a hand up from Angela Northcutt.
Yes, I'm here. Can you hear me?
Oh, yeah.
Okay, thank you so much. So hi, I'm Angie, and I am here to discuss our county mask mandate, as you've been discussing. I'm sure you all know that the CDC has recently admitted that cloth masks do not work. And as we know, that is primarily what our children are wearing at school. N95 masks recommended by the CDC to be more effective are not, I repeat, are not made to fit children. Even the CNN health expert this week stated that masks need to be removed from our children. Masks are creating psychological and social harms beyond repair. The number of children hospitalized in our state, either for or with COVID, which is not clarified in our state website, is overall fairly small. Our Monroe County Board of Health has recommended to keep our mask mandate in place previously until there is less than 50 per 100,000 cases. That seems almost unreasonable and an endemic number. The CDC has guidelines for the public to understand when masking is recommended and to help us make decisions, which it seems per the CDC website is this. The guidelines, the way I read it, are not there for the purpose of local government mandating rules on the citizens. When we ask the Board of Commissioners about the mask mandate, they defer to you, their appointed board. The Board of Commissioners have told us yesterday that they rely on science and data to make their decisions. If you have data other than this CDC guidance, please share. My husband and I routinely look at the IN.gov COVID-19 dashboard to see what's actually happening in the state. I'm sure you all are aware of this. If you look at the numbers, the cases in our county are right in the middle. There are counties all surrounding us and within the state that have more cases per 100,000, and there are counties with less cases per 100,000. If masks actually work, we should see a statistical difference in the number of cases reported in Monroe County. I do not believe we have seen that. If you have, please share that data. Because of your decision as a Board of Health to continue the mask mandate, our schools have no choice, and we as parents have no choice for our children. Your job as health officials is to make informed decisions. As you can tell, I'm really frustrated. At this point, it does not appear you are making decisions based on health, but your own personal beliefs, as someone stated here. And it clearly seems as though your decisions are political. The personal health decisions of my family should be my choice. Our children are being harmed. My first grader has never seen his teacher smile at him in his classroom because of your decisions. You need to remove this mask mandate now and put the decisions in the hands of the parents. And I've been on this call the whole time. And as Carol and Mark both stated earlier regarding the fecal matter and the waste and how to analyze this, all of this data should be used to inform the community with data so that they can decide for themselves as to how to handle the situation. That is exactly what Carol and Mark said, and that should be no different with masks. Thank you.
Thank you, Angie. Is there anyone else that is on to make public comment? I don't. Is there anybody else, Jonathan? Can you tell? Oh, there's my timer. Looks like we have a Candace Sampson.
Yes, hello, good evening. You can hear me, right?
Oh, yes, thank you.
Okay, yeah. So I echo everything that Angie just said. I 100% agree with everything she said. And I also agree with what Mark said earlier. I also just want to point out, I mean, you talk about science and data, and someone even said, oh, the science is settled on masks. That's totally not true and totally ridiculous. And then they went on to talk about anecdotal, oh, there was 2 hairstylists in a salon, and oh, there were, even the CDC, there was 500. I mean, you could break down every clinical study and find fault in the way it was done, or and you could find a study to be for or against anything that you want to prove. Okay, so let's just be realistic there. Secondly, we're on to Omicron. This is 2 years in, but even when COVID began at its worst point, the death rate is so small for everyone, young and healthy. This is a disease of, the elderly, the obese. I mean, everyone gets it, but the people that are most at risk are the elderly, the obese, people with 4 comorbidities, et cetera. This is America, okay? We have a right to choose our risks and benefits in life and what we want to do with our bodies, okay? We've always had that choice. I understand when this all happened, we all didn't know what to do. Everyone wanted to be safe. We can choose now if we want to go out, if we want to wear a mask, if we want to get vaccinated, if we want to travel, if we want to do whatever we want to do. That is our right. And that is how I feel, and that is how many Americans feel. That is how many parents feel. And most of all, our children, okay? Our children are the least at risk for any of this. There is so much evidence that shows that children are not super spreaders. They're not spreading it to teachers. And our kids are the ones that are suffering the most. Just like Angie said, our first grader hasn't seen his teacher smile. This is unacceptable. There are children that are having speech delays, developmental delays, mental health, suicide. This is health, okay? Stop being obsessed about a virus that has a, 0.1% death rate for children. This is absolutely insane. You need to stop mandating people's lives and listen to people like me, and also listen to data that is actually accurate. Stop listening to just one side. Even people that have your political viewpoint have already changed. There are multiple states that have lifted their mask mandates, multiple counties, people like in New York, California, they're lifting their extreme mandates. So we need to fall in line. This needs to end. And I really think you need to think twice about going back in the future and mandating people's lives. Oh, if there's a surge, look, it's a virus. People are going to do what they're going to do. And the vaccines don't prevent transmission. They don't prevent infection or transmission. So it's a personal individual choice, and it does not have a community impact.
Thank you. Your time's up. Yeah, I stopped this thing. There we go. Thank you for comments. I appreciate them. Any other comments? We have the Millers, it looks like. Hi.
Hello, good evening.
Thanks for joining us.
Good evening. Can you hear me?
Yes, we can. Thank you.
Perfect. So I appreciate the passion of the two prior speakers. My biggest concern that I have with regards to this whole masking, you talk about the N95s being 83%, which I'd like to see where that came from. I'd actually like to be able to see where that document actually originated. But, these masks were actually just set out on tables, just kind of distributed. I actually saw them in Indianapolis when they were distributed up there. I've not seen them here. They were set out on tables. You just kind of grab them free for all. So, masks that are supposed to be sanitary weren't even handed out sanitarily. All right. Those N95 masks actually, per the CDC, says that you can only wear them up to 5 times. The oils on your face actually degrade these things. All right. So these masks, they are going to become ineffective anyway. All right. It does need to come down to, it needs to be people's choice. We do have to go back to living life. As the last person said, there are kindergartners, there are first graders that have never seen their teacher's face. Flip that around. That first grader and kindergartner, that teacher's never seen their face. You don't know what's going on in that kid's head. You can't see the smile. You can't see whether or not they're happy. You can't see the passion, the drive in them. The other thing is all of this stuff is just creating turmoil for all of these kids. This actually, I agree, this really does need to end because it needs to become your choice. Your choice what you do. If you don't like those things, then people just need to if you're that scared, you need to stay home. Everybody else needs to go back to living. We've been dealing with this now for 2 years, and it is past time for this to just go away. I'm done. Thank you.
Thank you. Are there any other hands up? Jonathan, you see anybody? Peter Iverson. Thanks for joining us.
Thank you. Can you hear me?
Yes, we can. Thank you.
All right. Well, board, I would like to first thank you for your service and to say that the public trusts you. The proof is there that you've worked hard to keep our community as safe as possible, based not on politics nor your personal preferences, but based on science. And that science is clear that vaccines are the best defense against this virus. The science is clear. Masks work. Your messaging has been clear, and our community thanks you for that. Penny Cottle and her team at the Monroe County Health Department are the best in the state. The weekly press conferences show that Monroe County, Indiana University, and other sectors in the community are working together to put sound science into practice. As you take on the burden of continuing to make decisions to keep us safe, know that you have the trust of the community because you use your medical and scientific training to look at publicly available data. Those data are what you base your decisions on, not on anecdotal stories. And for that, I thank you for your service.
Okay, thank you. Anybody else?
Yes, I was also at Indiana University just a few days ago.
I'm sorry. So who's speaking? Is this True Epps?
Yes, this is true.
Okay, great.
Apps.
All right, great. Thanks.
I was at Indiana University a few days ago, and I actually ran into Mark Norrell, and we were having a conversation about it. It's crazy what's going on, man. We've been going through this for 2 years, like he said. The thing is, it's just getting crazy. Like, if you're scared, stay home. And I ran into Robert Wren as well, and we had a conversation about it. And we saw a man with a hole in his mask. He had a cigarette poking through it. How does that make any sense? You understand? How does that make any sense?
Okay. Thank you. Anybody else? Any other hands, Jonathan? Oh, here we go. Margaret, is it Minge? Did I say that right?
Hi, it's Mengi, Margaret Mengi.
Margaret Mengi, thanks for coming. Go ahead.
Sure. Yeah, Penny, I don't know if you remember, but we spoke on the phone maybe about 8 months ago. And at the time, we were dealing with a situation which the folks on this call probably would not have been aware of, unless, I don't know, maybe some of you have young children, but it seems like often the people who sit on boards and make decisions for our communities are not people who have children, school-aged children at home. So Penny, I brought to your attention at the time that because of the local restrictions, all of the summer camps for kids in our community had severely restricted the number of kids who they accept every summer. So hundreds of working families were shut out of all of them, in particular the city day camp and also the YMCA day camp. The YMCA day camp normally takes 350 kids, but last summer, because of your social distancing and masking guidelines, they only took, I think, about 150 or even less. And it meant that hundreds of families last summer who rely on these camps essentially for daycare, because we have to work and our kids have nowhere to go. So it's not just a fun camp, it's especially single parents like myself have no options. We have to book our children into camps or we really can't work. And if we can't work, we can't pay the rent, we can't live. So and Penny, I thank you for listening to me at the time. And I'd also spoken with the mayor, and the mask mandate was lifted, but then it was reimposed. It was lifted, that's right. It was maybe May or something. I'm forgetting now, but it was lifted, but it was too late. So camps like the YMCA had already only trained a set number of counselors and had already restricted their numbers to taking only 150 kids. I had to pay for an expensive overnight camp, which was $900 a week. Again, I'm a single mom, so that's really tough. If I have to pay $900 a week, for 8 weeks, you do some quick math. I can't afford that. I'm also getting really concerned. I ended up pulling my son out of public school this fall, in part, not mostly because of, but in part because honestly, the thought of sending him to school to sit on the bus and then sit in school 7 hours, 8 hours a day, wearing a mask, it was making me sick. It really was.
Your time's just about done if you want to.
Okay, it's depriving kids of oxygen. Okay, it's affecting a lot of things with the learning environment. And at this point, Penny, I do believe you're a well-intentioned person, and I'm sure you work hard at your job. But I think Bloomington and Monroe County is looking a little silly at this point. I just saw a headline online, Monroe County.
Margaret, your time's up, Margaret. Thank you.
It was New York.
Are there anybody else, Jonathan? And Margaret, if you could summarize what you'd like to say in about 10 seconds, we'll turn you back on. You know, go unmute her, Jonathan, just for a few seconds.
Can you hear me?
Yes, we can.
I just wanted to end by saying Monroe County, New York has lifted its local mask mandate. New York. So what is Indiana doing? What is Monroe County, Indiana doing? It's baffling, and I think it's kind of silly at this point. So I urge you to end the mandate.
Thank you. Anyone else, Jonathan? Seeing no one else. All right, not so fast. Kate Thurman, thank you for joining us. I think Kate's still muted. Jonathan, is Kate muted by us or by herself? Kate, I think you need to unmute. Okay. We can't hear you, Kate, because you're muted. Is there anybody else?
She may have accidentally raised her hand, Carol.
Okay. Is there anybody else, Jonathan? Oh, wait, I see Kate's mute is off. Are you there, Kate? Hello? No, she's muted again. Okay, Jonathan, is there anybody else? Okay, Kate says she's having technical issues. So in the meantime, since there's nobody else, let's get back to board comments after the discussion. Does anybody like to say anything at this point?
Well, I think, when somebody mentioned like the flu numbers in the chat, and one of the most fascinating things I think we've seen out of the COVID outbreak is we literally have the most historically low numbers of influenza cases for the last year or two. And one might surmise or maybe link the two that, that airborne virus hasn't been spreading as much because of masks, because of social isolation. And not that I'm encouraging that we all go back to, being in lockdown, or I'm not interested in that either. But, masks do work. And I think, even if the governor's order stops on the 4th, I will be one of those people that will continue on wearing a mask, just because I have my own health concerns. But I think it's important that when things like influenza get brought up, that we also understand that record numbers, babes. We're not losing the hundreds of thousands or tens of thousands of people to flu over the last couple years, but we have to COVID. And I care about those numbers, and I care about the health and well-being of every member in this community. We do look at reputable scientific data. We do pay attention. I definitely speak to a lot of people in the community. And, one of the things that I've been getting a lot of feedback on, Penny and Mark, and to the rest of the board, is that because there's so much confusion around COVID and the daily changes that they have, it seems like it's daily.
Hey,
that
I'm sorry to interject, but Carol is not paying attention at all. This is ridiculous.
Excuse
me. Why do you
me.
say I'm not paying attention? I'm making notes in my lap of what people are saying. Who said that anyway?
Well, thanks for, I don't really appreciate being interrupted there.
Who makes me interrupt is what I want to know.
So, I don't even know what I was saying, but you know, I mean, I was trying to like, you know, almost, well, not almost everybody on this board has a background in science. We're either degreed and we've studied and we practice, or we're doctors. And so this isn't like, you know, we're talking about, you know, training for the NFL. I have no opinion on that. No opinion on it. But I do have opinions, and I know where to find my research, you know, concerning public health outbreaks and public health precautions and safety and studies. And that's what all of us are here to do. We're not reading junk. We're not. This is not a political issue for the board. This is a bipartisan board. As Mr. Iverson said earlier, we are committed to working for our community and our members and your children. Your children are important to us. I don't have school-age children anymore, but I'm going to have a grandchild getting born into this. You know, so I guess that's all I really wanted to say, and that I'm going to be happy to do the recommendations. One of the things that this is where I was going, Mark, when I mentioned earlier, you know, our recommendations, I just don't know how we get this information out. As Penny, a lot of feedback that I've been getting lately is people don't know what makes the N95 mask better than cloth. They don't know how to make these decisions. They're not seeing this information anywhere, that we're not effectively communicating the various criterias and safety measures and this and that. And I feel like that's all we do. And the commissioners do, and IU does, and the hospital does. And, you know, so a lot of this information is just getting bogged down in the social media. It's being written about every day in the IDS, it's being written about in the Herald Times, the Indianapolis Star. The health department's Facebook page is the most up-to-date and active where you can get all this information. So, you know, I have heard the community that they can't find this stuff. So I just wanted to take a moment that when we do set forth our regulations, that, you know, we continue doing what we're doing. And I would like to figure out a way to improve the messaging. And I don't know what that is, Benny, that's kind of your area. But we've all been working really hard for every single one of these community members, all of you. And that's all I really wanted to say.
I know I've said my piece, but I wanted to just underscore something that you said, is we are concerned about everyone in this community. And one of the speakers before talked about, well, her personal risk is not that great. Young people are not that at risk, and it's only the old people who are at risk. Well, you know what? Some of the things that we're doing are to protect them, right? And your own estimation or your own calculation of your personal risk is not the only thing that's going on here, right? And we as a board are entrusted with the duty to make sure that every single person in this county is protected. So actually, that was a good comment. Every citizen.
Mark, I'd agree with that. We're interested in the community's health. And individually, it's a burden for school teachers. I teach the medical students some, and it's a hardship to do with a mask. There are an awful lot of problems, but it's a worldwide national fatal virus. We've got to do something about it. So please trust us to try to make decisions based on scientific information and deal with the people who are concerned about misinformation or misinterpreted information. I have a personal friend who's in his 60s, he has heart failure, and you know, that's not a good deal. So we're trying to help the community overall, and I want you to appreciate we're not trying to make a political statement or harm anybody's personal life.
I'd like to make some comments at this point, and I really appreciate all the people, and particularly, I mean, as you know, I'm a pediatrician. I'm very concerned about kids, and I am very concerned about the situation at school. And I really feel that we're on the cusp of things getting to a certain level of dull roar. And at that point, I agree that I don't feel like we need to have a mask mandate at that point, and that at some point it's going to get to the point where those people who are more vulnerable need to be the ones responsible for their activities and their behavior. I totally agree with that. And I really hope that I think we're really close to getting there. I'd love to see our vaccination rates go up, because I think that's in history, the way we've gotten rid of, and I'm pediatrician, so we give lots of vaccinations. Historically, the way we've gotten rid of and controlled disease, with the exception of clean water, which is the best thing we've ever done, is vaccination. That's how we've controlled the illness. That's how we do it. And so I'd really like to see vaccination rates go up. Having said that, again, people have choice. It's a choice. So that's fine. There are a lot of people who have gotten COVID. So a fair amount of people are being at least for a while from COVID. That's not so we probably have a fair amount of a community that is not profoundly vulnerable. There are people who will always be vulnerable. People who are elderly, people who have underlying disease. It's there, and that's just going to continue to happen. We're fortunate that Omicron has been relatively mild. However, having said that, our hospitalization rates are still high. They're coming down, which is outstanding. I'd like to be able to see them continue to come down. I think we're really on the cusp of being able to get rid of the mask ordinance. I really are. I really think so. Although I still think that as a health department, we need to emphasize to the community that there are people who are more vulnerable and are at higher risk, being those who are not vaccinated and those who have health risks. And I think that it's our responsibility as a board to have recommendations in place and ask our businesses to have signs basically stating what I just said, that the health department recommends that you wear masks, particularly if you are unvaccinated or at high risk. And I think that's one thing. And I don't know if someone wants to make that motion that we have those recommendations once our mask ordinance expires. And I think in terms of if we have to do it again, I think we've played this whole thing for 2 years. Things have changed on a regular basis, and as things change, we just simply have to respond to it. And we've been good at doing that. We've had meetings on with 3 days notice. So we can respond if we need to respond. And having said that, I'm fine with just letting the ordinance expire when the emergency order expires, and then having recommendations to put inside areas where to recommend it. And I'd really appreciate if the people who are making comments on the chat would just not make personal comments. If they have something to say that's appropriate, please stop making personal comments. Anyone else?
Well, you know what? You can't help but to read these comments as they come down. And, I just, a quick reminder to everybody, there's always been a trade-off between public health and your individual freedom. Whether it's seatbelts, whether it's you can't send your kids to school with the chicken pox, whether it's you can't, walk into restaurants without shoes on. It's part of being a community. And I know we're tired of it. We're all tired of it. And if the trends keep going the way they're going, then, it might just become endemic. And this is something like the flu, but I just hate seeing this infighting and yelling at each other over this. We anticipate the governor will get rid of the mask mandate on the 4th. Now, if we can't make it for another less than 30 days, then, I don't know. But the reality is we all have to give up some individual freedoms. It's a trade-off, and it always has been a trade-off.
Is Dr. Sharp have anything you'd like to add to this discussion? I think you're muted over there.
Well, my earlier comments did not relate to whether there was a mandate or not a mandate, only that the masks work. That was a neutral comment, and that came from the Indiana Board of Health, the Department of Health. They changed the name. It's IDOH. That's where it came today. And it was 534 people, and they're just, it doesn't say anything special except that masks can certainly help you avoid turning positive. Okay, that being said, that doesn't mean you have to mandate them. Whether we mandate them is up to the board. I know that I think we're the only county in the state that mandates. And I've said for a year and a half, I'm sure you're tired of me hearing saying this, but we vote with our feet. Just not like the speakers have said. However, we have this other circumstance, and then 2 or 3 weeks ago, the hospital was overflowing with patients. Well, we can't let things get so bad that people can't have their cardiac procedures and all the other things that are being delayed, including everything from orthopedic things to cardiac things to they call them elective surgeries, but they're really not. They're more important than it's not like I think I'll go in and have surgery today. It's important stuff for a lot of people. So if we're not careful and we allow the personnel to get totally bent out of shape and not to have be exhausted all the time and not be available, we've done a real disservice. So we have to tread water in the middle there somewhere. The mandate is for, as you know, for indoor persistent exposure. So, and it's, it's for you, some, but it's also for kind of a, something for the people around you, like the ladies at Kroger, the checkout people, because it doesn't take much to turn positive. And by the way, there were more deaths last year with all our tools than there were the previous year. So people still die. People still die of Omicron. And there's a new variant called stealth variant that's coming out. It's in New York, I guess, and a couple of places out on the East Coast. And it is apparently extremely virulent. I have not read a whole lot about it yet because there's not a whole lot going on. But that's, if we can get everybody vaccinated so that we'd stop incubating all these viruses and allowing them to develop mutations and variants that don't respond to anything. I mean, we're kind of set. We're kind of good now. We have vaccines and we have treatments, and so we have to use both. And people, I was, as I've told you also, I was shocked when the vaccine came out and people actually didn't want to take it because it's your best chance to. 85% of the people that are in the hospital are unvaccinated. 85% in the hospital with COVID. So you can still get in trouble with the vaccine, but it's way more likely that you're going to get in trouble if you're not vaccinated. Anyway, there's a lot to consider. We're still in red. We still have high numbers. It's going down precipitously. The state, we spent time Monday trying to determine what we're going to do when the governor let this his mandate or his order lapse, and then he let it go last minute, so it extended. So we're watching this stuff all the time. There's no right and wrong answer. There are trends and best advice. And, my best advice is if you have a lot of pre-existing conditions, which were mentioned before, you really need to be more careful than the person who is double vaccinated or triple and basically healthy. And, they can get out, but, and you're right about the kids. But then if it's 1 in 100 and it's your kid that gets in trouble, and not just with not just with the disease, but with a reaction to the virus that is life-threatening and makes you really sick for kids. So if it's 1 in 1,000 and you have the child that has the problem, who cares about the other 999? It's your child that got in trouble. And I don't, I'm no magician. I don't know what the best thing is to do about about the schools, because you're right, the risk is less, and Omicron is especially less. But we're treading a thin line here out in the middle, and I'm really pleased that the health board is so tuned into this and so sensitive about trying to do the best thing. I also don't like the children wearing masks. And that, I know early on, you remember I said it's not just the numbers; it's all the. Oh, what is that? Oh. It's not just the numbers; it's the other stuff, the suicides, all the mental health conditions. This is a really complicated thing, and it's not just about one or two things. You have to take it all into consideration. Anybody have any questions about any of that?
Thank you, Dr. Sharp.
Sure.
I think whatever else we do, we have to have a very strong recommendation to continue as individuals to recommend the masking, at least in public places where the population density is great and the ventilation is poor.
I agree. So any other discussion from the board? So the way it stands currently then, correct me if I'm wrong, Penny, is if we take no action, the ordinance will expire if the governor's emergency order expires. That's on March 4th.
As long as yes, as long as it's not extended.
Right. If things stop falling apart or getting profoundly better before then, we can have another board meeting before then if we choose to change things. I still am a little confused about this. Our ordinance basically says that schools need to follow CDC guidelines. It doesn't specifically say they have to wear masks in the classroom, right?
But they have to follow, yes, it says that they have to follow the Indiana Department of Health recommendations and wear masks in schools. So
basically, it doesn't specifically say that kids have to wear masks in schools. It says they have to follow Indiana.
Which means they must wear a mask in school. Right.
Because
that is the recommendation.
That's what the recommendation is from the Indiana State Department of Health. Mm-hmm. Right. So our ordinance doesn't actually control what the situation is in schools because it's the State Department of Health that really does it. And our ordinance just
it is our ordinance. It is our regulation that requires it because the state gives them the option with the recommendation to wear the masks. The difference will be that, and again, everything's changing in terms of how schools have to quarantine and isolate and contact trace and all that. there are specific requirements around that the state has that are related to whether or not they choose to have masks required in the school. So let's say that our order expires, right? Then if it expired tomorrow, then a school board would decide if they were requiring masks or not. And based on that decision, then their contact tracing, their reporting, all of that would be conditional on what they chose to do.
Okay. Thanks for the clarification. And again, you know, I do have a lot of empathy for kids. I do, but I do want them to be able to stay in school because they missed a whole year of school last year. And I think, you know, it's very, they need to stay in school, and however we have to do it works for me. So basically, so if we do any, so what I would like to do is everyone would like to make so I would like to get this, once it expires, I would like to have the health board make recommendations about continuing mask wearing as a recommendation, with the requirement that businesses post a sign that you guys will develop stating that we recommend it, particularly for those who are unvaccinated and at high risk. So someone want to make that motion?
Let me, and Jeff may still be on here. If you're making it a requirement, then that's a regulation. So
no, it's not a requirement, it's a recommendation.
Yeah, okay, just wanted to make sure.
But I think, so in terms of, but in terms of requiring businesses to put signs up, is that we'd have to make that as just that little tiny part a regulation?
Yes, that if you're requiring somebody to do something, that is not a recommendation anymore. That's a regulation. And if there are penalties associated with it, it's got to be formalized.
Does anybody see any pushback for people hanging up signs on their doors? I mean,
what kind of signs? You mean the recommendations?
A sign saying we recommend that you wear a mask inside, especially if you're not vaccinated or well, it's just to me it's like a PSA.
We can just,
it's like a PSA.
Yeah,
to me.
it's kind of like that. Yeah, it's kind of like the no masks, signs, clingies that we have currently out that, people choose or not choose, they do whatever they want or whatever the business allows them to do. I don't know.
And even if it expires, if businesses want to require people to wear masks, they can still do it.
They can.
As an individual business, they can do whatever they want.
Yeah.
Right?
Yeah.
Okay.
Yes, they can. And they were big advocates in us mandating the masks when all of this started, because they were concerned about their staff's health and the people that work there. So, us leaving, with not having the mask mandate, the businesses, they're going to have a harder time, self-enforcing is what's going to happen. So,
right. So,
if people want to get the recommendations, if the businesses want them, then I think we should offer them.
Yeah, I just feel like it's our responsibility as the health department to give that, make sure people have the information in their hands, and it's just a PSA. It's like a billboard for to me, it's just, I just would really like to see that as a way to communicate with people. It's just an easy way to do it, and it's painless, costs very little other than printing something. And
we can certainly, revise some of what we have or do some new ones and make them available to any business. We've done that all along, so.
I just think it's a responsible thing for the health department to do.
I go along with that.
So it sounds like what we need to do is not take any action right now. Is that right? Is that right, Jeff? We can do nothing, right?
But you don't have to do anything. I think you may consider whether you want to have another meeting before March 4th, if you want to have these thoughts in place when March 4th rolls around, so that you have the materials ready. And I don't think, I can't tell you I have any way to anticipate if the governor is going to extend it or not. We may closer to March 4th. Maybe we've never had an indication because he was going to extend it and that was his leanings. And if he's going to change, that might trigger something. So you may want to think about having another meeting before March 4th to kind of put together the materials you've just talked about.
That sounds reasonable. Anybody else have any comments about that? Okay. Any other board comments about the regulation? Hearing none. Okay. Is there any other new business? Got anything else? Nothing, Penny? Nothing you know of?
Setting your next meeting date, that would be it.
Okay, so let's get our calendars out.
So what, at least the week before the next commissioners meeting, is that, I'm sorry, a week before the governor's. Well, I guess it doesn't matter because they're just recommendations.
Let's see.
He's got burrs all over him.
What day of the week is March 4th?
March 4th is a Friday.
March 4th is a Friday. Yeah.
Okay, well, that's handy. So most weeks the data comes out on Wednesday, right? So if we had the meeting on March 3rd, would that work?
Yeah, I think the update is the day after the Wednesday, if I'm not mistaken.
Yeah. Is that right? I thought the county updates were on Wednesday.
They are.
Yeah, that's what I thought. Yeah.
So
if the governor doesn't send out his decision until the 4th, would it behoove us to have it like on the following on the 7th?
Well, I think it'd be good to have it. I think we'll have an indication. Plus, if we want to have anything else in position at that point, then we need to discuss that.
So what I'm hearing is what right now you're thinking with the anticipation that the governor will not extend the you want to continue our current regulation until the governor's executive order expires.
Correct.
Okay.
Yes.
And you want us to come prepared with, I'm going to say a press release, but with the recommendations that you want to share when that happens. And we will bring those for you to review at that meeting. I think the only other question, and you could decide that night what you want to do in the event that he extends the order.
Yeah.
If you want to continue until he doesn't, or if you want to go ahead and let it expire the next day.
Right. I'm good with that because that's basically 3 weeks from now, 3 weeks from today.
I agree.
And by that point, I think we should really be able to see what's happening with this spike, if it truly is going down. If it truly is going down, it sounds to me from the consensus of what the board has said, we'll be okay with the mask ordinance expiring.
Yeah.
If it's, I just think that there's correct me if I'm wrong here, my take is that people on the board are okay with that as long as the trend keeps going that direction. But right now, we're just kind of feeling a little iffy about it. So.
I would be a lot happier, yes.
Okay. And, okay. That sounds good. And I think it's good for us to have a plan for what, what we want the public to hear. Because I think it is important that a lot of people still need to be wearing masks, and to protect their own health. And it's just purely, again, a PSA situation.
Yeah.
So
doing the education that public health does.
Right. Because that's what we do.
It's what we do. And we work for prevention. And, I would like to think that, maybe we have helped some people.
Yeah. Sounds good. So we have, March 3rd at 4:30 work for everybody?
That works for me.
Okay. All right. Sounds good. So that's what our next meeting is. Thank you.
All right. And thank you. And thank you to the public for speaking to me.
Yes, I do appreciate what people are saying. And again, I'm particularly empathetic with the situation with kids. I truly am. And I just, we'd all like to see things getting back to normal. We truly would. So are we going to discuss anything at that meeting besides this, or is this just to discuss the regulation, or are we going to have it as a regular meeting?
That's a good question.
What else what is coming up that we need to talk about it? That's coming up. Are we like, we have
Penny.
Yeah. In April, we should have the annual report ready for you to review and approve.
That's April, though.
That's April, yeah. So, typically in the past, before COVID, you were meeting quarterly. So
yeah, right. We've gotten over that.
We can, have staff report for you, and we can look and see where we are in terms of who may come back and that kind of thing. But if you want to have I'm going to say a quick meeting, but if you want to just
a specialized meeting,
recommendations and decide what you're going to do, you could do that and be done.
I think unless anybody has anything else, I'd rather just deal with this one issue at that meeting, and then schedule the next meeting after that to deal with our regular business.
I agree.
Okay. Sounds like a plan. All right. So that's what we'll do in 3 weeks. Stay healthy, stay warm. And
thank you all.
Thanks, Carol, for running the meeting.
Thank you. Thank you. All right. You guys have a nice evening. Talk to you soon.